I'm going to use my remaining time to introduce you to a project that I've been involved in to try to get around the problem of not having good memoirs and biographies, and to try to capture the ongoing history of what's happening at the heights of Canadian health research. This is the creation of a video history of Canadian medicine. It's done through a very small organization, the Friends of the Canadian Institutes of Health Research, which is very much the vision of Dr. Angel, who is here this morning. Abhi decided that it would be a good idea to debrief great Canadian researchers about their careers. And over the last 8 or 9 years, we've done this for 8 of the highest achieving researchers in the country, ranging from Lou Siminovich, who we've now got 4 hours talking on film. We've done an extensive interview with the late orthopedic surgeon Bob Salter at Hospital for Sick Children, who was a pioneer in the use of continuous motion in orthopedic surgery. We've interviewed Dr. John Evans, who was the founding dean of the McMaster Medical School, which was in the 1960s the great innovator in medical education in North America, and a variety of others. I've done most of the interviewing. As with so much else, this is an enormously interesting learning experience. We've learned a lot about formatting and technological change. We're gradually creating usable DVDs of these interviews, and we'll soon be able to start posting these on the internet. Normally our interviews include from 3 to 6 hours of discussion. I thought that I would play just 3 snippets of these to show you what it looks like and give you some idea of what emerges from these. The first is going to be a clip from my most recent interview with Dr. Cal Stiller, originally a transplant surgeon based in London, always a very entrepreneurial kind researcher. In the 1980s, Stiller did exciting experiments with using a very powerful immunosuppressant, cyclosporin, that enabled him to do transplant procedures in diabetes, transplanting islets of Langerhans from healthy patients into diabetic patients. And by the use of cyclosporin, he was able to, it appeared, suppress the rejection phenomenon and enable some diabetic patients to go off insulin. It looked as though he had a cure for diabetes. In this little clip that I'm going to play, we have Stiller talking about this research, how it didn't exactly pan out, and yet, as is so often the case in research, you do take some backward steps, but you have, in fact, taken a few more forward steps. So, here is Cal Stiller. But it was at about this time, I remember first meeting you. I had just published my books on the discovery of insulin and banting, and you gave me the impression that you thought that this was the banting achievement round 2.
Well, it really did look like, because those were in early days, that it would be a matter of refining how early you started. Because patients who were treated after 6 weeks, there was only 15 or 20% of them became insulin independent. Whereas if you treated within 6 weeks, the sooner you treated after the diagnosis, the higher the incidence of a return to near normal glycemic control. So it looked like a matter of refining the diagnosis and time to treatment. It turned out that, in fact, cyclosporin was too toxic. We found out that the levels you had to have out after 1 and 2 years were so high that you began to get permanent damage to the kidneys. And so we had to stop it. This, however, was after we had done a randomized controlled double-blind study internationally involving Europe and the US and Canada. It was an extraordinary study published in Science. And although it didn't turn out to be the definitive treatment, it did turn out to be the definitive demonstration that type 1 diabetes was an autoimmune disorder that could be managed, controlled, reversed by immunosuppressive therapy if caught early enough. And so subsequent to that has been the search for an agent that is not toxic, or a way in which you can reestablish tolerance.
If it had worked, he probably would have had a Nobel Prize, but you can see him being philosophic about it. And it's true that there is a lot of exciting ongoing research now using different immunosuppressants in diabetes. Here's another example, Dr. Fraser Mustard, also still with us. Dr. Mustard, in his work first at Sunnybrook and then downtown in Toronto in the 1960s and 70s, was a pioneer in understanding the role of blood platelets and clotting in heart disease, leading to the remarkably effective, indeed life-saving realization that for many people, the regular use of baby aspirin can add years and years to their lives. Here is Dr. Mustard describing a fairly straightforward discovery that helps keep thousands and thousands, millions of people around the world alive today. Tell me in more detail how we go from platelets and thrombosis through aspirin.
Well, as we developed techniques for isolating platelets, and so we could study them without having to deal with the blood or anticoagulants, etc., we then became interested in things that affected platelets. And working with Hugh Smythe and Metro Grislow at Sunnybrook, they had a metabolic unit and they were dealing with gout. And I thought, well, maybe you could study platelet turnover because these people tended to get increased vascular disease, and therefore if there's vascular disease, platelets will be consumed. So I started doing platelet survival studies on their patients with gout. And what we found is that the patients in their gout arena who were getting this drug sulfentrazone had longer platelet survival than the patients with gout who were not getting it. So we said, well, sulfentrazone might have an effect on platelets. And then we started to test it in our little laboratory unit. Yes, there is an effect on it. So we became quite interested in all these drugs. As a matter of fact, Sibagagi flew me to Ball in Switzerland about all this, because they thought maybe they should start to do some work in this area because the drug was one that they had developed. And that was the first time I really had been treated sort of royally in this whole business. I was put on a first-class Swiss Air flight to get there, which was kind of nice, good food and all that. And so as we worked up that field, we realized that there were drugs which would be put into the class of anti-inflammatory drugs. And so one of the ones that you immediately look for is aspirin. And so by this time, Marion Packham, who's written that biography of me, had joined our group, and she was been working on this, and she was going to, well, was going to present all this work to a meeting in Ottawa. And I said, you better get on with testing aspirin because people will ask you questions about aspirin. So she did aspirin, and yes, aspirin worked. That's how we got to it.
Many of these medical researchers go on later in their careers to become important institutional leaders and international statesmen for Canadian science. A few even still follow the Osler path to the United States. As happened with one of this year's Nobel laureates in medicine, in fact, Ralph Steinman, who was a Canadian, but who did his prize-winning work on immunology at Rochester University and at Rockefeller University in the United States. Steinman had the misfortune to die between the time of the Nobel Committee's decision to award him a prize and the announcement of the decision. So we had the oddity this year of the Canadian-born Nobel laureate who had just died. Sad story. I've said that Cal Stiller was entrepreneurial. Cal Stiller was one of the key people involved in the decision to build a great center down on College Street devoted to the application of research. It's called the Mars Center, Medicine and Related Sciences. There's a beautiful building at college and university, and phase 2 of it is in fact under construction now. It's dedicated to translating pure research into practical therapeutic advances. So it's also the people we're working with in making these videos. Dr. Stiller, I've said, is entrepreneurial. He told me in our interviews of a discussion he had with his teenage son, who said to him, Dad, if we can have a hockey hall of fame in this country, where's the medical hall of fame? And Stiller said, all right, and became the founding person in the creation of the Canadian Medical Hall of Fame, which is in London. It was created about 18 years ago. It's still a growing institution, but there are a significant number of laureates now in the Canadian Medical Hall of Fame. And I thought I'd end my clips with some of the more sweeping observations that Stiller made to me on the global situation in health research and where Canada stands. Well, Gretzky, Crosby, Howe, Richard, we have produced great hockey players. We're staffing the Canadian, we're filling the Canadian Medical Hall of Fame. And we would like health in Canada to be, I suppose, as important, a more important enterprise than hockey in the long run. But are we falling behind globally? Are we really doing all we can to keep up? Many people would say the best hockey players are now from abroad.
The hockey player analogy is not a good one, because as the population that actually are involved in hockey at a young age grow, then Canada simply gets diluted by numbers. That's not the situation with respect to health and medical research. In fact, if anything, the great international benchmark, which has been the US, is falling, and it's falling dramatically. Not at the level right now of Nobel Prize winners, but at the level of early education and college graduation and competition with respect to math and science. And I feel badly because I love America and I think it's a great nation, but it is falling behind, and indeed it's the Koreas and Finlands and China that are the international benchmarks that Canada needs to aspire to. We punch above our weight, but we punch above our weight with respect to the scholarly side. We do not with respect to the translation. And so that has been my obsession over the years with respect to taking that goodness of our intellectual resources and translating that into what should be the economic activity. Canada has begun to provide some international leadership with respect to health as opposed to research. But I remain pessimistic with regard to whether the Canadian healthcare system can be transformed into something which is compatible with equality in its availability and excellence with respect to its performance. And the issue there, of course, is affordability.
But the moral of all of this is that our little conservative country has done a pretty good job of punching above its weight in health research. From Osler to insulin to stem cells and beyond. These are interesting stories, I think. There are a lot of resources to learn about them, and I can't think of a better field for your bright students, some of your bright students, to begin to go beyond the normal curriculum, to look into stories like these, to whet their appetites, and to perhaps help lay the foundation for their own higher education as scientists and their own later achievements on the frontiers of Canadian science. Thank you for coming and listening, and I have about 5 minutes if there are any questions.